Hello everybody and welcome to PCR London Valves 2025. I'm Chris Allen and I'm delighted to be joined by Georg Nickenig today from Germany. And we're talking about transcatheter replacements for the tricuspid valve. And we've got some exciting results from a trial presented at the late breaking clinical trials session. And this is a dedicated device, a transcatheter, transfemoral transcatheter device, I should say, that actually works in either the mitral or tricuspid position. We're focusing on the results for the tricuspid population today. Georg, could I ask you, what was the main question you were trying to address in the study?
Two questions. Efficacy, so are we able to reduce tricuspid regurgitation to mild or zero? And second question, of course, safety. Bleeding issues, myocardial infarction, stroke risk, pacemaker rate, mortality rate. These are the major questions we're trying to address.
Sure. And the study population, thinking about other trials of transcatheter replacement devices and the contrast, perhaps?
They're good questions. The inclusion criteria was severe or more tricuspid regurgitation and having symptoms, heart failure symptoms related to tricuspid regurgitation. And we had a lot of patients with massive and torrential tricuspid regurgitation in the study. Actually, more than 70% of the patients had massive or torrential tricuspid regurgitation. One reason could be because there is also a very large device available for the Cardiovalve, which makes it applicable also for these very severe cases.
Sure. And what were the main outcomes that you presented?
So the main outcome is the efficacy is really extremely encouraging. Despite the fact that we had so many torrential and massive patients in there, we had more than 90% of patients after 1 year with mild or less tricuspid regurgitation, which is an outstanding result. Yeah. So efficacy was very good, and that went along with clinical improvement. KCCQ score, so meaning heart failure symptoms or New York Heart Class, was nicely increased or decreased in terms of New York Heart Class, and exercise capacity as assessed by 6-minute walking test was also increased by 50 meters, which is quite a bit. Yeah. And KCCQ, by the way, by 21 points, which is really a significant result.
So signals of clear benefits then, both from hemodynamic and clinical outcomes. An area of concern in tricuspid valve replacement has been potential complications. What were the data on that?
We had in total so far a mortality rate of 6.4, but I have to mention that there was a very important iteration of the device which makes it a complete transcutaneous approach without surgical cut down, and that reduced surgical complications, vascular complications by 50% and also mortality. Yeah. We ended up with mortality of 4% in the last 68 consecutive patients, which is very competitive to other devices and other studies. Other complications were bleeding issues from the vascular side, but there were also in the 1 digital range. And then, of course, there was the pacemaker rate. We had 18% pacemaker rate in the patients, in the pacemaker naive patients. There were 24% of the patients entering the study had already a pacemaker in place, but they do not count, but the other patients do. This is still a number, 18%, but compared to other devices, it seems to be a bit lower, but we have to learn more about this, whether it is related to the device or maybe also to patient selection, oversizing. That's something we need to learn together also with the other studies within the next couple of years.
Absolutely, and that probably leads me to my next question. These are really encouraging results. What are the implications and where do you see it going next?
I mean, if you look in the field, I think we are pretty clear that we can improve symptoms, reduce heart failure, hospitalization, coming from the triluminate pivotal study, if we decrease tricuspid regurgitation in these patients. Yeah. And therefore we have a need for a dedicated therapy. Yeah. And then, with the same token, we have many patients which we cannot probably treat with a TEER device, which is first choice because safety is very good. Yeah. And all the torrential and massive patients usually come out of a TEER procedure not with mild tricuspid regurgitation. And therefore, there I see the role for a device such as the Cardiovalve device to be used in these patients.
Wonderful. Well, thank you so much for joining us. There you have it, some very, very encouraging data from a novel transcatheter tricuspid valve replacement device, and it will be finding its way in subsequent studies, and we look forward to the results of those. Thank you so much for joining us.